Good morning, guys. I'm very glad to get a chance to give you a speech in front of you. Let me introduce myself first. I'm Nisa Binte from 10th batch, and my class roll number is 120. Today I'll tell you about Naripokkho. Naripokkho is a membership-based women's activist organization working for the advancement of women's rights and entitlements and building resistance against violence, discrimination, and injustice. Since its founding in 1983, Naripokkho has conducted numerous activities related to violence against women in Bangladesh, which include campaigns, cultural events, training, research, lobbying, and advocacy. Naripokkho's recent projects are monitoring state interventions to combat violence against women, um, which involves regular monitoring of police stations, hospitals, and courts, and the third phase of Women's Friendly Hospital Initiative, which involves the operationalization of a protocol for management of violence against women cases in government hospitals. They are working with Women's Health and Reproductive Rights (SRHR) at community level, monitoring government health care facilities and increase accountability of service providers are key components of their work and monitoring. CBA partners do advocacy and lobbying with local relevant authorities for potential solution of the existing problems and for further betterment of service provided from the hospitals of centers. They did a lot of years well. Mental health, contraception, safe abortion, reproductive cancers, HIV or AIDS, comprehensive sexuality education, sexual rights, etc. Mental health. They monitor progress in the region as well as gaps and restrictions within the framework of various international progresses such as ICPD, MDGs, and the BPFA, looking at pregnancy and childbirth-related mortality and morbidity indicators. They advocate for a context-specific writers-based continuum of quality care (CQC) of reproductive health. Contraception. They monitor indicators such as total fertility rates, wanted fertility rates, contraceptive prevalence rates, men's contraception use as a percentage of total contraception use, informed choice in using contraception, unmet need for contraception, non-use of contraception, and emergency contraception. They believe that contraception is not only an issue of access to health services but of women being able to decide on the number, timing, and spacing of the children they bear. Safe abortion. They have recognized that advocacy is almost the only means whereby laws, policy, and practice in countries can be changed and have been facilitating the sharing of experiences among concerned and committed people and organizations through their various partnerships. Reproductive cancers, as interventions on reproductive cancers are considered more costly than those of for contraception or mental health, there is a greater struggle in establishing women's rights to access preventive and curative services. Additionally, unequal socioeconomic situations coupled with sociocultural barriers and poor or inadequate healthcare infrastructures impaired the prevention, treatment, and care of reproductive cancers. HIV. The prevention and treatment of STI in the region has largely been driven by the HIV intervention efforts. HIV intervention focuses on the high-risk behavior groups such as sex workers, men who have sex with men, and injectable drug users. As a result, the larger population who are at risk of STI but do not fall under the high-risk categories are not prioritized for prevention and treatment programs. Although in some countries, a concentrated effort has been made to target young men and women in prevention against HIV and STIs. The status of HIV or AIDS prevention is mixed across the region. Well, the vision and mission of this NGO is that is an equal, just an equitable world that enables all women to be equal citizens in all aspects of their lives, and that protects and advances their sexual and reproductive health and rights. They promote and defend women's rights and their needs, particularly in the areas of health and sexuality, and reaffirm their agency to claim these rights. Thank you.